This March, we observe Cerebral Palsy Awareness Month, marking 20 years of raising awareness, promoting inclusion, and of course, celebrating the strength of those who live with CP. In this special segment, Redefining Normal, our host Shamla Maraj leads an insightful conversation on cerebral palsy awareness, joined by neurologist Dr. Nicholas Maraj. And together, they explore the realities, challenges, and triumphs of life with CP, shifting perspectives and inspiring change.
Good morning, everyone, and welcome to Redefining Normal. Do you know that what we do in our early life matters later on? And this is more prevalent with persons who are living with a physical disability, such as cerebral palsy. So today, I want to explore things that children can do so they would live a good, better adulthood. So I have Dr. Nicholas Maraj, who is a neurologist, here to talk about early intervention. So good morning, Dr. Nicholas. How are you doing?
Hi, pleasant good morning, Shamla. So lovely to be here. Thank you so very much for having me.
It's always a pleasure, Dr. Nicholas. So, Dr. Maharaj, what is cerebral palsy and what causes it?
All right, so let's start simple. CP or cerebral palsy is a condition that affects a child's movement, muscle control, and posture. Usually happens because of an injury to the developing brain, either during pregnancy, around the time of birth, or shortly after that. And one really important thing to understand is that cerebral palsy is not progressive. That is, it doesn't worsen over time. However, the way that it affects a child can change as the child gets older. And more importantly than that, it's not necessarily something that the parents cause. Lots of them carry guilt, and a lot of them shouldn't. And in most cases, it's not very preventable.
Agreed. So, what are the early signs in babies that might indicate they have CP?
So I kind of tell parents to look out for the milestones. First few months, you might notice poor head control, stiffness, sometimes the opposite, they might feel floppy, difficulty feeding might be a clue. Around like the 6 month mark, babies should be rolling around, engaging, interacting. And if that's not happening, is maybe with some questions from the 9 to 12 month time period, we expect them to be sitting up, starting to move, maybe trying to crawl. And a really, really early red flag is early hand preference. If before the age of one, a child is using more one hand than the other, that could suggest weakness on the side that they aren't using. As they get older, delayed crawling, delayed walking, walking on the toes, or uneven movement could be some things. So these are some of the milestones to look out for. And if you're missing these, that should warrant some level of caution and concern.
That happened to me. When a child isn't meeting development milestone, how long should a parent wait before seeking advice?
Don't wait. Don't wait at all. That's the whole point of this conversation. So start with your pediatrician or like a qualified other medical practitioner to get early assessment. Sometimes it might just be nothing and or might not be anything serious, and that's good. But if it is something, you gain in time, and when you have time, you could intervene. So don't wait for a formal diagnosis to begin intervention. If there's a delay, we could start the therapy.
Definitely, I agree. So, how critical is early intervention, and what type of therapies also can make a difference in the early years of a child?
Intervention is very practical and very hands-on. The core types of therapy are physical therapy,
Mhm.
occupational therapy, and speech therapy. Physical therapy helps with movement, strength, posture, and occupational therapy kind of helps with everyday functioning, grasping, feeding. play-in type of things. And speech therapy is important for communication and swallowing. Some cases, we could use medications to help with muscle stiffness, and sometimes even assistive devices, such as the one that you're sitting in right now, can help support development. One of the most important things as well is parents. You really need to have involved active parents because therapy doesn't happen just in clinic with the therapist or with the medications. It's happening every day at home. And simple, consistent exercises makes massive, massive differences over time.
And just speaking from experience, I would say, like, for example, not just having the assistive devices like having a wheelchair, is how you structure the wheelchair for that individual. Because from my experience, just saying from my experience, as a child, my posture damaged because of the wheelchair. I used to sit in, and now I'm paying for it, literally. So it's a whole it's a whole ecosystem you have to deal with when dealing with a child with CP, and it requires really plenty knowledge, reading, and also patience. So once a
Yeah, very
concern is raised, what does the process look like from the doctor's visit to getting support in place?
So with patients with like mild symptoms could go on to live relatively completely independent lives. Others might have a bit more challenges but achieve meaningful improvements, and these are the key thing is like early important maximizes potential because the brain is still developing. There's a lot of neuroplasticity. And in Trinidad, we have still skilled pediatricians, physiotherapists, as well as therapists who are doing a lot of excellent work. Yeah, we have a whole bunch of neurologists that are very active in trying to assist patients, families, as well as the therapists in identifying what they need to do to try and achieve the milestones that necessary and help where there's a bit of a dysfunction to develop strategies how to kind of accommodate for that.
So for viewers who like don't know about CP, right? It shows different in everyone. Each individual who has CP is very different, right? For example, I move a lot, but there are some people with CP who is very stationary and dense, and there are others who could walk, right? So what causes that? Because I know it's the brain and it's very technical with those brain damage.
It all because it all depends on where the brain has become injured in the process. So the frontal part of the brain is a bit more responsible for mobility. There's a part of the brain that's important for planning and coordinating movement called the basal ganglia. So that could be affected, causing some of your type of symptoms where you have the athertotic ringing type of hypermobile issues. When the brain doesn't be able to send the signals, sometimes the muscles can become super stiff, and you can have the stiffness type of cerebral palsy. And you can have it being mildly affected, more moderately affected, or very severely affected, as the case may be. But the whole important thing is early understanding, early identification can help find early intervention and help reduce the risk of long-term challenges.
So for parents who now are being introduced, to their child and having CP, they may be frightened. What can you tell them about this and accepting the process and understanding their child?
The first thing to make sure and explain to them is that one, this is not their fault. A lot of them just carry so much guilt, and you see this racking up a lot in parents. So you need to try and help alleviate that stress off of them so that they could put a lot more effort into taking care and providing the necessary support services for their kids. Yes, there are some challenges, access, cost, availability of these support services, but there are options for the north, south, east, and west parts of Trinidad. And even and also in Tobago, sorry, can't leave out Tobago. And even where access is limited, home-guided therapies could still be very effective, things that you could find on YouTube, things that the printouts that the physiotherapists and speech therapists and occupational therapists give you to practice at home. Those are really, really, really important. Really important.
I agree with that. And how can early treatment help reduce and prevent challenges like posture alignment issues later on in life?
Yeah, so when earlier intervention can help support the muscle strength, provide the necessary mind-body connections that comes with physical therapy, occupational therapy, to be able to get these muscles stronger, get them more coordinated with each other, reduce the risk of fatigue, tension on the muscles, allow certain medications can be useful to ease that stiffness also. And then patients could learn techniques to help offset some of the muscle strength issues and be able to accommodate with what other natural strengths that haven't been affected by the cerebral palsy itself.
Definitely. And in closing, what would you say to adults with CP, in terms of maintaining what they have right now, in terms of some, as you mentioned, it's expensive, right? Some don't have access to get to the physiotherapist, doctor, and so on. What can they do at home, to support in terms of posture, muscle mass, keeping of muscle mass, and so on?
The good thing is we have such good access to the internet and online resources such as YouTube to be able to just look up what sorts of home exercises, home physiotherapy options are available. That's really, really important. In the age of telemedicine, where you can have a physical interaction with your physiotherapist, where they're not based in your home, but you can have that interaction with them online. That could really, really help access to patients who live in more remote regions, because as you know, cerebral palsy does make it difficult for mobility and in terms of challenges to get to or from a clinic. So early detection could make all the difference.
Definitely. So, Dr. Maraj, I would like to always say thank you so much for coming and imparting your professional knowledge on, for us. It's really eye-opening. There are many things that we discussed, and I know, it's stayed with me in terms of knowledge. So thank you, and I know it does for the audience as well. So thank you so much as always, and it's always a pleasure.
Thank you so very much, Shamla. All the best, TNT. Have a lovely day.
Thank you. And guys, with that being said, I want to say thank you so much for tuning in to this week's segment of Redefining Normal. As I always say, be good, do good. Bye, everyone.